I'm Dr. Steve Barnes, and I provide world-class health care at MU's Frank L. Mitchell Jr. Trauma Center. I have always been fascinated with both medicine and surgery. Trauma seemed to be the ideal mix of caring for the sickest of the sick and operating on some of the most devastating injuries that one can imagine. The combination of the rapid pace, the need for immediate decision making, and the benefit of seeing someone who is near death who comes back to see me 6 months later, having resumed their life as it was before their accident. So trauma care is a multi-specialty process, and that's what makes University of Missouri Healthcare and the Frank Mitchell Trauma Center the Level 1 Trauma Center. It is a combination of pre-hospital personnel from our paramedics that go and get people from the point of injury, whether that's in the helicopter or on the ground, to the nursing and the emergency medical staff that will at times initially see people in the emergency department, to our trauma team, which is mostly made up of general and trauma surgeons who meet the sickest patients on arrival to the trauma center. But in order to be a Level 1 Trauma Center, we have to have input from our neurosurgeons, our orthopedic surgeons, our radiologists, our plastic surgeons, our urologists. The fact that we are providing world-class health care can only be done because we have a commitment to caring for injured patients that goes across all specialties and touches all corners of the hospital. So conflict generates generational leaps in understanding of how we care for injured patients, and we've been in a decade of conflict which has provided lots of opportunity for learning of the best way to care for people. There have been two major findings, lots of smaller ones, but the major ones that we apply to Central Missouri are the way we resuscitate patients when they are sick after injury and the way we transport patients. Our physicians and surgeons in the Department of Defense have changed the way health care is delivered on the battlefield, with rapid evacuation and the global movement of casualties happening in 3 to 5 days, where you could be injured on the battlefield of Afghanistan on Monday and be in the United States by Wednesday or Thursday, having been operated on 3 or 4 times. Those concepts of staged care and rapid movement to higher levels of care are the basis for our Level 1 Trauma Center in our region.